Hey Christian, what's going on, man?
Hey, good morning, Eric. Things are great. Yeah, I had a really good past couple days working with our private practice. Had several new clients, getting some good outcomes. Just having a really good time. It's amazing what seeing 4 people in a day does compared to seeing 18. It's pretty dope.
It's a nice change of pace, huh?
Yeah,
Yeah, yeah, right. Yeah, we're gonna have a great time here discussing some fun possible.
the end of our profession as we know it.
We're all screwed. We're all screwed, or we're gonna die. It's over. It's over. Pack up shop, and move. It's actually funny. I was talking to a coworker about this, and I semi-jokingly said, you know what? If this, if what we're about to talk about here, Christian and I, is going to be the demise of our profession and everything, I was like, I already know what I'm doing. I got my backup plan. I'm going to trade school, being a plumber, and
You
that's my
already got the
backup.
stash. I think you're just getting ready.
Right. Exactly. No, I was like, I already got it. I'm good to go. I don't know what you guys are doing, but when we go under as a profession, I'm going to plumbing. See you
I'm
guys
doing
later.
OnlyFans. Get to work from home.
That would actually
Yep.
probably make a lot more money and be a lot
Hey,
less
dude.
disgusting than a plumber.
Well, I
It's
don't know
that
about that.
it
Different kind of disgusting.
Yeah, different kind of disgusting. All right. So what we're going to talk about is something that came out recently. I heard of it first from Kyle Covington, our APTA president, sent out a statement email on the U.S. Department of Education and their proposal to turn the multiple healthcare professions, it's not just PT, but PT being one of them, from a professional degree to a graduate degree. And people have been quite up in arms about this. I've even had like previous professors reach out to me and like they're like, what the hell is going on with this? Because it's a big thing. You have a lot of undergraduate students that want to go to these different fields that require, post grad education, or not post grad, post undergrad, I guess. And if things are changing, students are going to be less apt to do that. And so, Christian, what's the reason why they're doing this? Do they just hate physical therapists and healthcare professionals and they're trying to knock us down a peg, or what's going on with this?
So I actually don't know the reason. We can speculate in a moment, but this is what's happening. So in order to get student loans from the federal government, there's different classifications of what your degree is, and that helps decide how much money you can get as a cap. And so currently, physical therapy, occupational therapy, physician assistant, they're classified as professional degrees, along with physicians and dentistry, chiropractors, law. And that means that they can take out higher loan amounts to cover the cost of those programs. And the government has proposed reclassifying the rehab ones like physical therapy and occupational therapy, but not chiropractor, weirdly,
They got good lobbying.
from a professional degree to a graduate degree. And what that means is it lowers the cap on the loans that you can take well below the average cost to attend physical therapy school. So, for example, I think roughly the average cost is going to be $50,000. And if they cap the federal loans much lower than that, that means that in order for people to go to physical therapy school, at least people that are not wealthy, which is a major issue, then they'd have to take out more private loans, which will have worse terms, higher interest rates. They can be quite predatory. So the big fear why everyone's freaking out about this, at least in the PT world, is that if you reclassify the PT profession, you lower how much they can take out for loans, you're going to have fewer people enter the profession, number one. And then number two, the people that are already in the profession, they're going to get overworked more than we already are. That is going to lead to more burnout, which is going to just throw gas in the fire of having fewer PTs available to help the patient population that we have, which is ever growing. People are getting older, they're living longer, they have more issues. And so you're just going to have a massive shortage of affordable PTs.
Yeah, right. That's definitely a downstream consequence, I think. And another 2 points I wanted to make, Christian, that when you were talking about that, and I was talking this with some coworkers earlier this week when this came out, but we were just speculating. I don't know if this was like a report that came out or if this was something that's true or not. One of the main reason that we came up with as to why we're trying to go from a professional to a graduate, and that they're lessening the amount of loans that people can take out, right? That whole downstream effect. The only reason that we could think of it was that if programs, let's say, are at 150,000 on average, and students can only take out 100,000 now, so now there's a lot less students going to these programs, which means the programs are losing money, which means the programs will be their hands will be forced to have to lower their tuition, right? And again, I don't know if there's a report on this out there. That's what me and my coworkers were speculating about, was like maybe this was the reason why, to force, like, yeah, we're going to have to change the name from professional to graduate. But with that, the downstream effect is going to be forcing the hands of these programs or universities to have to lower how much it costs to go to, let's say, PT school, right? To make it more affordable, I guess, is the thought. And so I don't know if that's right, but that's just something that we speculated because we were
That's
trying to make sense of this.
Yeah, well, that is a potential silver lining that I also have heard about or read about in probably similar blogs as you. And
Yeah.
yeah, I think that's highly aspirational and certainly could happen. But I don't know the business aspect of different colleges and how they set their rates. I'm sure we're definitely get screwed for sure. Like I know that. But
Yeah.
what are the chances they're going to actually substantially lower the tuition costs? I think that's very low. I think what's probably going to happen is they're going to focus on getting more people into the degrees that are going to pay more money. So they would just expand dentistry and
Mm-hmm.
medicine and chiropractor, for example. I think that would just be easier to get more people to matriculate into those programs than it is to slash the costs of your PT. They would just start to like phase it out if it's not financially
Yeah.
viable.
Yeah.
I don't take an optimist view on this potential change leading to lower tuition rates. And even if they were lowered,
Yeah.
how much lower will they be? Probably not that much. So this is my thought, is that reclassifying them is largely a means to serve the financial institutions that we already have, the big banks. If you cut out federal loans, you now have less debt that the nation's going to be in, and you just put that potential debt onto private institutions where they can charge much higher interest rates. So I just have this whole like the government and the big banks are probably in cahoots. The government doesn't want to take on more debt anyways because the US we have tons of debt, and the big banks are like, we'll gladly take that debt.
Yeah. Yeah.
And so that's what I think is probably a bigger reason why it's happening. It's not some like freaking
Yeah.
fantastic idea to lower tuition rates for PTs. No.
That is, see, this is why we talk about it, because I wouldn't have thought of that before. Didn't think of that. Which also very well is another downstream effect of this. And this hasn't, the other thing that we should, before we get too deep into it, this hasn't passed. This isn't a thing yet. It's proposed, I believe, early next year, so like January, February of 2026. There's going to be like a public forum that's going to be open for people to comment on it, and so the Department of Education gets a sense of where everyone's at. And so nothing has happened yet. Christian and I are just breaking this down and talking about different routes that it could be affecting us as a profession and as prospective professionals, which is another thing I wanted to get into then, Christian. This is going to come off as an absolute jerk of a comment, but it is something that I think is a viable comment. Let's say it goes into play and students have to take out private loans or whatever it is. And then students are less apt to want to go to school, right? We already see a reduction in the amount of PT applicants, I believe, going to PT school from undergrad, right? And so it's less competitive now is what it was. I remember back when I was an undergrad, or back in like high school undergrad, so that would have been like, I don't know, 10, 11, 12 years ago. I remember thinking about PT school and like it's extremely difficult to get into, which it still is difficult to get into, absolutely. But as we see less and less people wanting to go to be a PT, now the supply and demand is getting more evened out. And so now there's individuals that, might have make it into PT school or a graduate level program where maybe 15, 20 years ago when it was much more competitive, they wouldn't have made it into said program, right? And so my concern is that we're going to start letting people into these programs just because it's going to be able to keep the program afloat from a financial standpoint, when those prospective students may or may not have the ability or should be in said program, right? Just from a educational standpoint. Like, can you pass the rigorous aspects of these classes? I remember back when I was going to PT school, we had multiple times where our program was kind of handing out freebies to students so that it can, help them pass the classes, right? And then when it came time to do the boards exam, we had a much higher rate than normal for our program of students who failed the boards first try. And I don't think that's a coincidence for people who weren't able to pass these courses, which are very rigorous, takes a lot of time and effort and being able to understand these things. And then they're given these kind of freebie passes. And then 3 years later, when they take the boards, much more people are failing them than what they did on average, right? I don't think that's a coincidence. And so my concern is that in order to be financially viable, let's just start whoever wants to come in. Let's come on in. Let's keep this boat afloat. Let's keep it afloat. Like, we're unfortunately, like, again, not sound like a jerk, but I would get concerned that we're going to be lowering our expectations as a profession in terms of our standards of what it means to be a physical therapist.
Yeah, you really bring up a core debate that's in our profession. I want to be clear, like this conversation, I know we're talking mainly about our profession, but this is really more patient focused too, in that it's really good for
100%.
patients to know, like, this is what could be happening to your experience of physical therapy if this new bill were to pass, these changes were to be enacted. And then, like, what are our thoughts being doctors of physical therapy around the idea of degree bloat? Should we really be a doctorate level profession? And then should we just go back to a bachelor's or a master's, whatever? So this stuff matters for patients. And so, like, the core debate is the doctor of physical therapy degree required to get really good outcomes and be a good physical therapist? And I can see both sides of the argument for sure. For some context, physical therapists in other nations, especially European nations, they are not a doctoral level degree. They are, it's almost like a trade school. They might do 2 years, 2 to 4 years out of high school, depending on what country you're in. And then the question is, like, okay, do they have better or worse outcomes compared to US doctors of physical therapy, or even US bachelors or masters of physical therapy who are folks in their like 40-year-old or older? And the answer is, it doesn't seem like there's a massive difference in outcomes based on your degree level. It's more related to how much time do you have with your patient? Because given enough time, you can do a pretty good job. And I'm saying that I'm not really comparing Europe to America. It's more like within America. So when you compare bachelor's or master's to the doctor of physical therapy, we don't have a ton of evidence to suggest that it's much better or worse one way or the other. But we do know that the higher your certification after your doctoral degree, meaning you go from getting your doctor of physical therapy to a residency or a fellowship, or to what Eric and I have, which is our board certification in orthopedics, when you get to those extra layers, there are definitely improvements in outcomes for people. When I say better outcomes, I mean they get better faster, they get better to a greater degree. We miss fewer things, meaning we get the diagnosis right sooner, or like we see things like red flags, like signs of cancer or a major issue, much better than people who have a lower education level. And so ultimately, you get better faster and you save money. We save you money by being better trained for you. And so I don't think it's entirely inappropriate to say that that might exist to some degree from going from a bachelor's or a master's to a doctorate level degree. And I love your point, Eric, about just the commitment to the profession. When you have a degree only require 4 years, it's easier to get into. There's fewer requirements. When you add in these layers of complexity, when you add in things like, oh, they now have to apply to physical therapy school. In order to apply, they have to have a certain GPA. They have to have a certain commitment to the profession by getting observation hours or doing undergraduate research, which is what you and I did. And then you've got to go through this interview process where there's maybe extra writing stuff you got to do. You got to take the GRE, for example. By having those filters in place, you are selecting for higher quality candidates, which then is more likely to lead to higher quality professionals when they exit the program, which then leads to you, the patient, having better outcomes. And so I think that is a very real thing. And I would be devastated if they change a degree in America from the doctorate to a lower degree again, because I really think you're just going to lower the floor of our profession and things are just going to get worse overall. And I think about this like the military. Everyone has their worth. Everyone has a purpose. You have your enlisted folks. They're great. They're going to get the job done to a certain degree. But then you also have elite level soldiers. You have people like the SEALs, for example, who have to like be the cream of the crop. They have to pass a ton of different tests, mental and physical, in order to do a certain level of job to a certain standard. And there's a reason we have that. We have that process because it works. It filters for higher quality individuals. To a lesser degree in physical therapy, that is still happening. You still need some kind of filtering process to get the right candidates into the job. And getting rid of that, I think, is very dangerous for the health of our profession. And not just that, the health of our populace.
I love the analogy.
I knew you'd
Love
like
it.
that.
I got
I
me
knew
going.
you'd freaking.
I agree. I think at the end of the day, it does revolve around our patients, right? And what they have access to or what the type of care they're going to be given, right? And this is why I also like just want to stress the point of like and this is maybe getting a little bit away from what's going on with Department of Education. Like as a PT profession, we have to make sure that we're still holding ourselves to a very high standard. Like especially when it comes like PT school, right? I know that COVID was tough on everybody. I know it was hard, but the benchmark is the NPTE, right? Like the MPTE didn't change or create lower standards after COVID did, right? And it's
That's
kind
our.
of exactly, yeah, yep. And it's kind of like the same thing with this. Like if this does go through, right? Our board exam with the NPTE, we can't like maybe it has to change for some legal reason, I don't know. But like when it comes to the rigor that it takes to pass that thing, we can't be lowering our standards because what's that going to do? It's going to lower the quality of care that we give to our patients, right? And then as a profession, we already kind of get the short end of the stick with a lot of things. And if we start to become a profession that's even performing at a lesser rate or, doing things to a lesser quality, right, for patients, and then that's just going to continue to snowball on itself. Now, I'm not trying to paint like this bad, like negative picture for physical therapists. Like I think at some point though, it's good to just face reality and look at like where are we at, right? We became a doctorate level profession so that we could get more independence. We could have direct access. We can, get more reimbursement from insurance companies and get paid more and like all these wonderful ideas and wonderful things. And I mean, I've only been a PT now for coming up on 4 years. So I'm not saying that I've been around every single block in this profession. I know what's going on. I'm sure there's people out there that know much, much more than me on this stuff. And maybe I'm just ignorant to the thought. And, 20 years ago, I would have had it very rough. And now that we're a doctorate level profession, et cetera, I'm have it much better than what I think I do. Right. But I'm also hearing all these like crazy stories about people burning out, all these crazy stories about physical therapists that like can't even live in a modest apartment and pay their student loan bills and pay all these other bills because they don't get paid enough as a physical therapist. Right. Like friends who are literally looking at like second jobs on the weekends as a physical therapist with their doctorate level degree because they don't get enough payment. That's because we're not getting reimbursed enough from insurance companies. And like I've even heard stories from like hospitals of like they're kind of like, yeah, like PTs, like we kind of break even on you guys, right? Like we're not really, you don't make us any money. If anything, we like lose money on you guys, right? And like just these stories where it's like, damn, I thought we were great. Guess we're not as great as I thought we were. And so before I lose my train of thought on this, holding ourselves to that higher standard still, right? Because what I would hate to see happen, not only for our profession, but for our patients, is that the bill passes and we end up losing the standard at which we hold ourselves to as physical therapists. And that slowly just kind of degenerates the profession from the inside out, right? That's what I wouldn't want to see happen from all the points that Christian and I have made previously on this. But on top of that, I want to just also take this time. It's not like anyone's going to friggin' hear this thing anyways, but hey, APTA, like what are we doing? You're our association. I thought we are supposed to be advocating for us as professionals. What are we doing? Like we got a doctorate level program as a professional degree to obtain all these wonderful, beautiful things for our profession to just grow, grow, grow. And since we've been a doctorate level profession, has that stuff really changed or come into play at all? Like, if anything, I think compared to where we were at 10, 15 years ago with inflation, like, are we really making that much more money as like an entry level new grad compared to someone 10, 15 years ago with their master's or even just like a bachelor's degree? And that might be an ignorant point that I just made, but no, I think it's this whole idea of like pushing to stay a doctorate level profession. But with that, I also think we need to start actually working towards getting the benefits of what that entails, right? From many different aspects, from, respect from peers to higher insurance reimbursement to, higher pay, theory, less burnout, like, but I think that all these things are an important thing to keep in mind as we continue to move forward with this process and, keep an eye on. And like I said, early next year, there's going to be a public forum for everyone to give their take on it. But as much as I want to continue to be a professional level degree and continue to stay at this doctorate level program, I also think that if that's the case, we should start seeing the fruit of being a doctorate level program. And unfortunately, I think that does start with the APTA and the association advocating for us as professionals and actually getting us some benefits from it. Because you always hear about how they're advocating on Capitol Hill and doing all these great things, but then year in and year out, we're seeing less insurance reimbursement. Or like, yes, we do have direct access. This is true in the state of Minnesota, at least. But I can count on one hand how many times in the last 3.5 years I've had patients come to me as direct access. So, like, is it really working that well if only 3 to 5 patients in 3.5 years have used direct access for physical therapy in a state that actually allows it?
That's a really good point to stay on for a bit. So, like, why did we go to the doctorate in the first place? Yes, you have people that argue that it was just because we want to have an alphabet soup after our name. We want to be freaking cool and have the title doctor. Sure, whatever. That might have been part of it for some people. But the major reason why we tried to make the switch, why we did make the switch professionally to a doctorate level degree, is so that we could have direct access. What that means is that you, as the patient, if you want to see your physical therapist, if you didn't have direct access, you had to see your doctor first, had to get a referral. That takes many weeks. Often it costs you a lot more money. They'd probably want to order some kind of imaging. So before you even walk in the door to see a physical therapist, you probably spent $500 to $1,000 and wasted weeks of your time. And you rolled your ankle, dude. Like your shoulder tweaked. You don't need to go to your doctor. You don't need imaging.
Yeah, it's
You're
pointless.
wasting everyone's
Not
time. You're
pointless, but
wasting your
it's,
money.
yeah.
Right. But in order to legally go to a physical therapist, at least in the United States, you have to have the direct access qualification. In order to have that, you have to be a professional degree. And there's like a certain rigor of education that's required so that we are prepared. If we're going to be the first people to see you off the street, we have to know how to look for scary stuff like breaks, fractures, cancer, other major diseases. And so the doctoral level degree prepares you better for that kind of stuff. Also prepares you better for differential diagnosis, meaning that because we've spent more time learning stuff, we've been exposed to more conditions and we learn how to better filter for those conditions. And so we recognize issues much sooner and we can streamline that process of getting you better faster than people without that doctoral level degree. In theory, that's the whole purpose of it. And then also, to your point about communication with our higher level peers, like physicians, for example, when you have physical therapists working at a doctoral level, there's a certain standard of knowledge and communication that is just inherent of reaching that degree level to where we can talk at a similar level about our patients to these doctors. So we can communicate better about you much more quickly. And so that leads to you getting expedited help. And there's not like this, just like this weird, because we're all human. There's obviously political stuff going on professionally in that not every doctor is going to want to talk to a physical therapist because they don't consider themselves on level playing fields. But when you get those fields a bit more similar, people are more likely to talk to you and take you seriously as a physical therapist. And that's going to lead to better patient care overall. And so I think that's really important as well. And I've seen that play out with my experiences with doctors where I work with my other job, in that they approach me with questions and ask me for advice,
Mm-hmm.
which I thought was kind of weird when it first started happening, but I understand why, because they recognize that we have a different skill set and they respect that skill set. And then my final comment on direct access, I think it's vital, it's critical, it's super important. Like, why the hell would I want to go see my doctor if I just rolled my ankle? I should just go right to the PT or right to the chiro. That should just be a thing that I can do. I'm an adult. I can make that decision for myself. And if I feel like I need to go to the doctor after that visit, then I will. Not a huge deal. But at least I don't know about the rest of New England, but in Maine in particular, we are a very big direct access state where a large proportion of my clients see me before they see their doctor. And then me and the patient decide if they should go see their doctor. And I think it overall is a really, really good system. And there's even tons of evidence on it. Tons of evidence on what do things look like for the patient in terms of outcomes and cost if you have direct access physical therapy, especially direct access PT from higher level specialists like Eric and myself. You save money and you get better faster, like I said earlier. There is very clear research evidence on that. And a lot of it is funded by the insurance companies themselves. One of the studies I'm thinking about when I just made that statement is a study that was partially funded by Anthem, because they wanted to see, is it more affordable for us as the insurance provider to just send our clients to PT first? And so that's what you see in our profession already happening, where like if someone wants to get an MRI, for example, at least in Maine, they often need to do physical therapy for at least 6 weeks because they know that the patient's probably going to get better without the image in that time frame if the physical therapist behaves to a certain standard. And so for me, direct access is just crazy helpful for the patient, but also for me professionally. It's freaking fun. I like seeing people off the street. It makes me want to be better because like I need to be ready for anything. I need to be ready to be able to be like, oh, this is scary stuff. I need to refer you. Here's who to refer you. Here's how I'm going to do it, whatever.
Right. Yeah. I think I agree with everything you said there with direct access. I think it's a vitally important thing. And I think that it's very appropriate in many cases when it comes to, just multiple kinds of aches and pains that people have. Unfortunately, we don't see that as much here in Minnesota. I think the basis of what we're trying to do with the doctorate level program, with direct access, with all these different things that the APTA is pushing forward and why we went from a master's to a doctorate, like it all has very good intentions behind it. And it's all to help not only make us better as PTs and professionals, but also care for our patients better, which is the most important thing. So um, I think at the end of the day, that's my take on this is for the patient care, staying at a professional level for everything that Christian and I have talked about, the points we brought up. Staying at a professional level degree and the doctoral level degree is the most important thing, I think, for patient care, and continuing to validate us and keep us to a high standard as a profession. But on the flip side of that coin, if we do stay that way, people in much higher positions of power than Christian and I think need to start actually manifesting some of these ideas and thoughts of what could happen as a doctoral level profession and actually start to make that come to be so that we can start practicing like doctorate level professions versus, a lot of people would probably argue we continue to practice like we have our bachelor's or our master's.
So here's my wrap up thought on this, just to kind of like bring it home. My fear around reclassifying us is that you will have fewer physical therapists entering the profession. What that's going to do is it's going to lower the total number of physical therapists we have that can do the work. What that means is that the companies that hire physical therapists are going to want to make their money, of course. And so you're going to have very high demand for physical therapy with a very low supply of physical therapists. That's going to lead to physical therapists needing to take on more patients per day than we already do. It is already quite common to see your physical therapist in a bigger company setting or like a chain PT clinic setting to have 2 to 4 patients at once. You're getting terrible care. I don't care
Which
how
is
good your
so
PT
messed
is.
up. It's so
I'm
messed
sure
up,
there are PT and like Eric, you and I, when I first met you, when you were my student, I worked at a clinic that was like that, where we had 2 to 4 people at once, every
which is
hour,
also
every
messed
day.
up.
Yeah, like it's not great patient care. And so you're going to just have fewer PTs coming into the profession, and the ones that you have remaining are going to get more burnt out than we already are. Physical therapy already has a 50 to 75% burnout rate. What that means is that these therapists are so overburdened by the workload and the lack of, combined with the lack of, or not lack, but like lower pay relative to our debt burden, that more of these PTs are going to just leave the profession. And so you're going to compound this issue, exacerbate it even further to the point where we're going to be seeing like 3 to 5 or 6 people at a time. And it's like, I'm essentially just a group exercise trainer. Like, what the hell am I doing? I'm not doing physical therapy.
Yeah. Right.
And we're going to get even worse outcomes. If people are just not going to want to go to PT, they're just going to live with these chronic pain conditions or whatever they have for even longer. And what that's going to do is that's going to lead to even further healthcare issues, like these people having these issues for longer, leads to more pain medication, leads to more imaging, more doctor visits, leads to more insurance costs because of all of that for everyone, because we got to subsidize that with our premiums. People are just generally less healthy. It's like these problems snowball in so many ways that it is just like so clearly apparent to me that this is a foolish decision to make. And it's really only going to harm our society over the next 5 to 10 years if it were to pass, let's say, next year.
Right. And I think another way of how I'm looking at that as well as what you said there, Christian, is it's going to handcuff us, you know. And I think we know that as physical therapists, not to be like arrogant or whatever word you want to throw in there, but like we clearly have great services to offer society, and we clearly do great things day in and day out. A lot of therapists do, and this is just going to continue to handcuff us and lessen the downstream effect will be lessening the level of care that we can give the patients, even though we see time in and time out and plenty of research studies on conservative treatment through physical therapy, especially. I just got done reading the phase 3 trial for the restore trial phase 3 for Peter O'Sullivan's CFT work that he's doing. I reread that this week, and it's like, man, like this debilitating chronic low back pain, which people spend tens of thousands of dollars on through many, many different avenues of medical care. And you see something like CFT over what, 6, 12 weeks, and even at the 1 year follow up. And I believe they're even seeing stuff at 3 year follow ups of how much better people are getting with CFT. And you look at how much we're saving in healthcare dollars, and it just blows my mind. Why would we want to handcuff that ability to treat society with the biggest burden that we have, which is chronic low back pain? And this is going to do that. This is going to, well, shouldn't say that as an absolute, but there's a good likelihood that's going to handcuff us as a profession, and we're not going to be able to, treat patients with aches and pains like that to get better. And yeah, it's going to be tough. But yeah, so I think we have similar endings to what our wrap ups would be there, Christian. But obviously, this is one thing that we're gonna have to wait and see how it goes and where it comes out as, and hopefully it's best. Hopefully, there's a solution that's best for everybody, including us as a profession and prospective students coming in and the patients that we give care to. And yeah, hopefully we can see everything work out in the end, but who knows? And if you are concerned about it as a profession or just as a layperson, like I've said several times now, there's going to be ability to give your comment early next year and make your voice heard. So encourage everybody to do that. Christian, any other thoughts or ideas around this topic?
No, that's it. Thanks, man.
All right. Thank you. We'll be back probably not next week. Well, we have podcasts in the books, but I'm going to be gone next week though. And so we'll have to schedule for one after that. But anyways, thanks everybody for listening, and reach out if you have any questions or ideas on other things you want us to talk about. Otherwise, we'll see you next time, Christian.
All right. Later, dude.